Has Fetterman been tested for cognitive impairment? Voters have a right to know. John Fetterman's painful debate performance has raised a vital question for Pennsylvania voters. Does the Democrat have speech and auditory processing issues, or did his stroke leave him with serious cognitive impairment? If his stroke damages his ability to think and hear, but has not to think, many voters might not care. After all, if Fetterman were deaf and needed closed captioning to understand what people are saying, or if he had a speech impediment that made it difficult for him to verbally communicate, few would question his fitness to serve. But if his stroke was damaged his ability to understand and process information and thus make competent decisions about serious public policy issues, that is an entirely different story. Many people have no cognitive complications after suffering a stroke, but according to an article in the medical journal Stroke, more than 40% of stroke survivors are found with cognitive impairment, post-stroke cognitive impairment, sometime after the event. Almost two-thirds of these patients are affected by mild cognitive impairment. Meta-analysis showed 10% developed dementia soon after first stroke. More than a third had dementia after recurring stroke. There are several clinical tests to determine whether patients experience cognitive impairment. 2018, when there were questions President Donald Trump's cognitive fitness for office, Trump asked the White House doctors to administer a test called Montreal Cognitive Assessment. She reported passing with flying colors. The test is 30 points and designed to take 10 minutes. Patients are asked to draw a clock showing the times 10 past 11, including the proper hands and numbers to list as many words they can think of begin with a certain letter of the alphabet. To repeat a list of numbers forward and backward, to repeat certain sentences word for word, to explain several ways two objects, an orange banana or a train, a bicycle, are alike. To repeat a series of numbers in backward order, to subtract from 100 by sevens, to name the year, month, exact day of the week, and the location, city they are in. Score of 26 is greater considered normal, 18 to 25 is considered mild cognitive impairment, 10 to 17 considered moderate cognitive impairment, and a score of less than 10 is considered severe cognitive impairment. There are other cognitive tests Fetterman could take, like mini mental state examination or the cognitive assessment scale for stroke patients, which is designed to assess post-stroke cognitive impairments. Patients like Fetterman, who appear to have severe expressive aphasia, lost ability to understand or express speech. Has Fetterman taken any of these tests? If so, what were the results? We don't know the answer because Fetterman has not been transparent about his conditions. He won't release his medical records, which would show the result of any kind of test he might have taken. After Trump underwent his assessment, his then White House doctor spent nearly an hour taking questions from the media at a White House news briefing. But Fetterman won't make his doctor available to the media, so reporters can't ask what testing the candidate has undergone, or details of his cognitive prognosis. Fetterman has a history of being less than forthcoming about his medical condition. Recall that his campaign waited nearly 2 days after stroke, said that he was in the hospital in weeks, to disclose 2017 diagnosis of cardiopathy, separate heart condition. Voters are being asked to elect a senator who just had serious stroke. They might be willing to do so, as long as they can make informed choice. They have a right to know whether what they saw in last week's debate, simply a man struggling with speech and auditory processing, or something deeper. Fetterman can test results. Has no cognitive impairment he can easily put any concern about his capacity to rest. He has test results that show impairment and refuses to share that information with voters. Could qualify as deception should render him unfit for office, regardless of the effects of his stroke.